Imagine you have just had a medical procedure, perhaps a lumbar puncture, and now you are experiencing a headache that feels unlike any you have had before. This specific type of discomfort can be quite challenging, often worsening when you sit or stand. Understanding this unique headache is the very first step toward finding relief and feeling better. A spinal headache, technically known as a post-dural puncture headache, is primarily managed through conservative measures like lying flat, ensuring good hydration, and consuming caffeine. If these initial steps do not provide sufficient relief, medical interventions such as an epidural blood patch may be considered to resolve persistent and severe symptoms. This distinct headache occurs because a small amount of cerebrospinal fluid, or CSF, can leak from the puncture site in the dura mater. This dura mater is the tough, protective membrane that surrounds your brain and spinal cord. This leakage reduces the fluid pressure surrounding your brain, causing it to gently sag downward when you are upright, which then triggers the characteristic pain you feel. To effectively manage a spinal headache, the most crucial initial step is to lie flat as much as possible, as this reduces the gravitational pull on your brain and can significantly alleviate pain. Additionally, focus on staying well hydrated by drinking plenty of fluids, which can help your body naturally replenish cerebrospinal fluid. Consuming caffeine, either from coffee or through a prescribed medication, can also be beneficial as it constricts blood vessels in the brain, further helping to reduce headache intensity. If these conservative approaches do not improve your symptoms, or if the pain is severe and debilitating, your doctor may recommend an epidural blood patch. This procedure involves injecting a small amount of your own blood into the epidural space near the original puncture site, which then forms a clot that seals the leak and restores normal fluid pressure. An interesting detail is that the specific needle type used for the lumbar puncture can influence the risk of developing this headache. Smaller, pencil-point needles are generally associated with a lower incidence. Furthermore, the effectiveness of an epidural blood patch is remarkably high, often providing immediate and complete relief within minutes for many individuals. Knowing these factors can provide comfort and confidence in the management plan. Ultimately, managing a spinal headache effectively involves a combination of supportive home care and, if necessary, targeted medical intervention. By understanding the underlying cause and following a clear management strategy, you can successfully navigate this temporary discomfort and significantly improve your recovery experience after a lumbar puncture. Always communicate clearly with your healthcare provider about your symptoms and progress.